Welcome to NCLEX Map, where we blend clinical judgment with confident action. Today, we're diving into delegation and scope of practice. Imagine this. A UAP reports a drop in urine output for a postoperative patient. Should the nurse delegate monitoring or assess right away? Let's break it down using current guidelines. First up, when a patient's condition changes, the RN must assess first. A decrease in urine output isn't just routine, it signals potential complications. Assessment and clinical judgment are not tasks to delegate to unlicensed assistive personnel. They're critical responsibilities of the RN. Why is this urgent? Reduced urine output could indicate hypovolemia, obstruction, or early acute kidney injury. Oliguria is defined as less than 0.5 ml per kidney per hour for 6 hours. If we delay our response, we risk renal ischemia or shock. This is serious business. The RN's immediate action: head to the bedside, verify the measurement, and check the catheter for kinks. Don't forget to palpate for bladder distension, assess vital signs, perfusion and pain, and review intake and recent losses. If the patient has a Foley catheter, flush only per protocol after confirming obstruction while maintaining sterility. If urine output remains low despite your efforts, notify the provider promptly for further orders or labs. Documentation is key. Record the exact urine volume, time, interventions performed, and who was notified. Timely charting supports continuity of care and legal accountability under the Nurse Practice Act. After assessing, the RN can delegate stable, clearly defined tasks like measuring and recording intake and output. You can also delegate emptying the drainage bag, obtaining vitals, and reporting specific changes like output under a set threshold. Remember the 5 rights of delegation: right task, right circumstance, right person, right direction, and right supervision. For example, you might say, "Please measure urine output every hour and notify me immediately if it drops below 30 ml or if it looks dark or bloody." Clear, measurable instructions help define accountability and ensure patient safety. Clinical benchmarks indicate that adults should produce roughly 0.5 ml/kg/hr. Persistent low readings post-op may signal kidney injury or fluid deficit. If the bladder is distended and no urine flows, suspect post-operative retention. You can delegate a bladder scan to trained staff, but you must interpret the results. If vital signs show hypotension or tachycardia, treat the situation as unstable. Start fluid resuscitation, check IV patency, and escalate to the rapid response team as needed. Reinforce teamwork by teaching UAPs to report using clear phrases like urine under target or no output in 30 minutes. Always acknowledge their report and reassess the patient directly to close the loop. Key takeaway: routine monitoring can be delegated, but assessment and decision-making are RN responsibilities. The moment data suggest instability, the RN must take full control of care. Delegation is about professional distribution of care under RN supervision. Remember, judgment precedes delegation. When in doubt, always assess before you assign tasks. Your license protects the patient, and your judgment drives outcomes. The art of delegation is about trust and verification. When your team communicates clearly and you respond decisively, patient safety thrives. Thank you for tuning in to NCLEX Map, the engine that transforms knowledge into confident action. If you found this lesson valuable, like, share, and subscribe for more insights.